Good afternoon and welcome to our Tuesday at 2 Erie County COVID-19 update from the Rath Building. You'll be hearing from Dr. Gail Burstein soon, and of course we're joined today by Kendra Schmidt from Deaf Access Services to provide the American Sign Language. So thank you, Kendra, for always that. Her and Karen have been stalwarts for the past year and some months helping out and doing a tremendous job. So thank you, Kendra. We have, of course, a lot of information, some very good news. We're headed in the right direction, but also some sad news with regards to deaths that are just a number we're a little disappointed in, but we'll talk about that. Erie County COVID-19 case data summary. Since the beginning of the pandemic, there have been 86,282 confirmed unique cases. So these are individuals. These are not duplicates. We know in all likelihood the number is higher, but these are the confirmed ones through May 2nd. During the last 7 days, we had 1,628 total new cases in Erie County. That is a number would be equivalent of 177 total new cases per 100,000 residents for at least the 7 days that ended on May 2nd. That is good because it's a number we want to continue to see going down. Remember, 100 over a 7-day period is equivalent to a high risk of transmission. We were in the 300s not that long ago, so we have seen a big drop, but we're still not as where we'd like to be. Hospitalizations as of May 2nd, there were 248 individuals that were in hospital with COVID-19 in Western New York, 76 in the ICU. Of those, 206 patients were in Erie County hospitals. 61 were in the ICU, 41 on an airway assist. Another 5 individuals died on May 2nd. We do not have the confirmed residents yet, if they're Erie County residents or not. Probably most of them are, but they might be from other Western New York counties. And we do offer our deepest condolences to those who've lost a loved one as a result of COVID-19. Erie County hospitalization data on April 19th through May 2nd, you saw the big drop in hospitalizations in basically this 2-week period. We've basically stayed stationary though the last 4 days. So we had a pretty good drop from what would be considered April 19th to the end of April, and then we've stayed fairly static in Erie County the last 4 days with 200 plus patients in the hospital. The ICUs make up 30% of the patient count that are COVID-19 patients, and 58% of the COVID-19 hospitalizations are individuals 64 and under, and that number is important, as we'll show with regards to mortality data very soon. The confirmed cases over the past 6 days, we have seen, as we noted, a substantial drop. This is dated as of May 1st because we run these on a weekly basis, ending on particular days, so we can do a comparison week to week. I just gave you the numbers for it effective as of May 2nd, so it actually has gone a little bit lower, but there are 183.8 cases per 100,000 residents over a 7-day period. That is a 26% drop from the week before, for the week ending April 24th, and actually about more than a 50% drop from the week ending April 10th. So we've had a big drop. You can see the numbers and how they have reduced. That's a good thing. We are not seeing as many new cases as we were, but we still saw nearly 1,700 cases last week. And we know as compared to last summer, in which we had tremendous drops, we want to continue to see that. We don't want to see that grow, and hopefully with the warmer weather that will continue to drop. But we are headed in the right direction. That's a good thing. I want to thank everyone for taking this seriously because of the issues that we had dealt with through January and February, and then we saw this big increase starting in March and April. We're starting to go down again. That's a good thing. News COVID cases by zip code, not always easy to read this, but all this information is available online. The highest zip codes were all Buffalo based. If you look at it on cases per 100,000 residents in a 7-day period, the 14215 had the largest number of gross cases, complete new cases, and it also had one of the highest numbers with regards to population over 7 days if it was 100,000 population. So what we're seeing, and we'll talk about this too with mortality data, we've seen more new cases coming from the city of Buffalo. We've seen more new hospitalizations coming from the city of Buffalo, and unfortunately in the month of April we've seen more new deaths coming from the city of Buffalo than what we've seen in literally almost a full year. So this is very disheartening. It also correlates to vaccination data, as we'll talk about. But the zip codes that had the highest new cases last week were based on the population. If it was this imaginary 100,000 population, was in the city of Buffalo. So we've seen a big drop in the suburbs, a good-sized drop also in the rural areas. We're happy about that. We want to continue to see that. But unfortunately, the city need to do better. So the residents in the city of Buffalo, we really need you to do better. And the easiest way to prevent illness and death is, of course, vaccination. So confirmed age group, we are still seeing the largest in the 10 to 39 age category. So the most cases are coming from what would be considered school-age children, middle school, high school, as well as the younger working age adult in the 20 to 29, 30 to 39. The older adults are better. We also know that the older adults are generally more vaccinated. And if you notice, in the past 7 days, there are only 26 new cases in the 80-plus category and 56 new cases in the 70 to 79 category. Very few cases in the older age population, which is important, of course, because they're more at risk for serious illness and death, and it's also because we have some very good vaccination numbers with regards to the older age population, which Dr. Burstein will talk about a little later. But for the younger folks, if you're under the age of 16, you can't get vaccinated. If you're 16 and above, you can get vaccinated. Get vaccinated. Even if you're young and you think, I'm healthy, I don't have to worry about this. If I catch it, it's not going to affect me. It is affecting people. Some are getting very sick, and as we'll talk about, we've also had, unfortunately, too many deaths in the under 49 age category in the past month. Confirmed new cases by age, weekly comparison. If we do a week to week, thankfully there has been a decline as we look at it in the school age category, the 5 to 10, 11 to 13, and 14 to 17 category. There has been a decline in all of those age categories. Almost every one of the age categories, I believe, had a decline, except there was a slight increase in the 18 to 22, like 0.1%. But in general, we did see a decline across the board, and that is good because what you're seeing now is people not only taking it seriously, but more vaccinations being out there, more people being completely vaccinated through their second dose, or now the Johnson & Johnson, which is available again. And it's protecting more people, so not as many people are getting sick. And there's also some early analysis that shows the vaccinations also in some ways are helping to prevent the further infection and the spread of it, so that's a good thing too, but we'll know more about that as the months go by. The cases in schools dropped. It's quite apparent we had a big bump associated with the Easter break and spring break. We know, and I was talking to one of our epidemiologists yesterday, just to give them a big shout out to our epidemiology staff. They do a great job. Mary Wallawender, Michael Amano, and their team do a tremendous job. They've been working very hard behind the scenes, and they're the ones who compile all this data. But I was talking with Mike Amato yesterday, and he noted that a lot of the folks that they saw from these school-age cases were mostly, or school cases were mostly children, and for many of them, they had been on spring break with family or had been at like big Easter celebrations and the like. And now that that's passed, we're seeing a drop. So big shout out to our epidemiology team for compiling all this data, getting this information, especially from our contact tracers, because it gives us the information that we need to know to address the COVID-19 cases in our community. But we are happy to see that the cases in schools have dropped. It's now the lowest it's been in roughly 6 weeks. So that's a good thing with regards to these new cases associated with schools. And we talk about these numbers, we're talking about all cases of individuals in schools, not just students, but teachers, faculty, of other and administrators and other staff. So we have seen a drop, and that's a good thing after having a big bump with regards to the Easter and spring break period. Now the mortality data, we haven't shown the full percentage in some time, so I wanted to show this because it also has an impact with regards to what we were seeing in the month of April. If you look at this data really hasn't changed a whole lot lately. 81.2% of deaths are whites. They make up 80.6% of the population. 14.4% of deaths were black African American. They make up 14.6% of the population, very close. Residents, this is something we wanted to look at. Buffalo, 23.9% of the fatalities, this is in total, have been City of Buffalo residents. They make up 27.9% of the population. Erie County, excluding Buffalo, 76.1% of fatalities make up 72.1% of the population. 1,829 of our fellow county residents have died as a result of COVID-19. Just a terrible number. It's a little more than a year. And as I said before, we offer our deepest condolences to anyone who lost a loved one, family member, as a result of COVID-19, regardless of where you live. But what we've seen in the last month has been a growth in the number of deaths associated with younger people and specifically in the City of Buffalo. So this is the mortality data by age group for 2021. We can now confirm that through April 29th, 91 Erie County residents have died in the month of April from COVID-19. That is a fairly substantial increase from March, in which there was only 57. The average age of death in the month of April was 71. The average age of death in March was 77. It was 76 in February. It was 81 in January. 43% of the people who died resided in the City of Buffalo. Remember, the average has been, I'll just go back one slide, the average had been 24%. It was 43% for the month of April. And that's through the 29th, so there's one more day that we still have to get data and confirmation for. And the City of Buffalo only makes up 28% of Erie County's population. Remember how I talked about we've been seeing spiking cases in the City of Buffalo. It's been the City of Buffalo zip codes that have had significant problems with regards to new cases in the last month, and now we're seeing the deaths. The highest case rates in recent weeks are in Buffalo zip codes. The lowest vaccination rates in Erie County are in Buffalo zip codes. Two important stats. Of the 91 individuals who died in Erie County in the month of April from COVID-19, only 2 were fully vaccinated, and in both cases, these individuals had significant immunocompromised issues. So there was always going to be a question as to whether or not an individual, once they were vaccinated, was going to be able to build up enough antibodies to protect themselves if they caught COVID. Unfortunately, these 2 individuals out of 91 died even though they were vaccinated, but they had serious immunocompromised issues beforehand. And here's a very distressing figure. I didn't talk about it just yet, but we're going to talk about it now, even though you can look at it in a chart. April 2021 ties April 2020 for the most deaths in any month under the age of 49 with 11. As of through April 29th, 3 people under the age of 40 had died, and 8 between the age of 40 and 49 had died. The only other month that had the same amount was April of 2020, in which there were almost 3 times as many full deaths. We were in the heart of the pandemic, the first real month in which we felt the pain associated with it, even though we had been shut down in March. We were starting to see tremendous deaths in April of 2020. So as a percentage of all the deaths, more younger people have died under the age of 49 in the month of April than we had in April of 2020. And unfortunately, based on the information we're hearing from hospitals, I'm sad to say that the individuals that are in hospitals, a lot of them are in this under 50 age category. And I'm fearful that some of them are going to perish as a result of COVID-19. And as we noted, of the 91 individuals who perished in this past month of April, 89 of them were not fully vaccinated. Get vaccinated. We've seen the vaccination numbers. We can compare it. We know very few people. It's less than probably 5 at this point who've been fully vaccinated, have died as a result of COVID-19, and in every one of those cases that we're aware of, the individual had serious health complications associated with immunocompromised individuals. I mentioned my one friend who passed in March. The individual had serious immunocompromised issues and was going through cancer treatment. So if you're a healthy individual, you get vaccinated, it's going to protect you. It could save your life, and unfortunately, 11 individuals under the age of 50 died in Erie County in the month of April, and that's the most, ties the most for April of 2020. And it's possible if somebody perished on April 30th that we'd actually have more people die in the month of April 2021 under the age of 50 than we had in any other month, including the worst month, which was January of this year, or for that matter, April of last year. With that, I'm going to turn it over to Dr. Burstein and talk a lot about a number of the issues, including, of course, vaccinations. But the number one thing I want to remind everybody before I get back up here later is get vaccinated. It's the easiest way we're going to get back to normal, and it's the best way to protect yourself. If you get vaccinated, you will protect yourself, you will protect your loved ones, and get fully vaccinated, and the proof is in the pudding. There are very few people who are in hospital who are fully vaccinated, and it really, other than those who have serious immunocompromised issues, it'll prevent you from dying. And too many people have died in the last few months who probably would be here if we had gotten them vaccinated. That'll turn it over to Dr. Burstein.
Thank you. Good afternoon. So I'm going to announce some good news and some bad news. So first, the good news. The governor announced that the capacity for different events and gatherings is opening up and expanding. So there have been a lot of changes lately, and we strongly encourage that anyone who is planning a gathering or works at one of these venues and is planning an event, please read the reopening changes very, very carefully and make sure that you adhere to them, because everything is changing rapidly, so please pay attention to detail. But all that is available on the New York Forward website. Again, our bread and butter, where we start with COVID-19 control, is making sure that people know their status of COVID-19. There is plenty of COVID-19 testing available out there. The Erie County Health Department, we are offering free COVID-19 testing so you can know your status. Again, call 716-858-2929. You can schedule a diagnostic PCR test. And then we have those results available usually between 1 to 3 business days, and then our rapid point-of-care tests, and those are available on site before you drive away. So please, if you're suspicious of any reason, you have symptoms, even mild symptoms, or potential close contact or travel, and you just want to check your status, please get tested. And I just want to share some concerning trends that we've seen with our case investigations. So, even though we're seeing a decline in number of cases, we're still having some challenges making sure that we're doing a good job with disease control. So first of all, what we found through our case investigations is that many people who have a family member in their household that is infected and should be in isolation really isn't in isolation in their household and repeatedly expose other people in their household. So that does two things. One, it repeatedly exposed everybody in their household to new COVID-19 infection. And two, it extends the period of quarantine for those people in the household, because remember, it's for 10 days after the last exposure of someone who's contagious. So if people keep getting exposed during that 10-day of isolation, they'll need another additional 10 days of quarantine. So please, isolation is to stay in your own place, not even near anybody else, even in your household. Also, what we're finding is, businesses are deeming employees essential and having them come to work when they really should be in quarantine. And then we're finding, unfortunately, in many of those instances, people do end up getting infected when they should be in quarantine and then exposing other people at the workplace. And also, we're seeing a lot more clusters. We're seeing clusters in cases in childcare centers, youth sports teams. The most where we're seeing the sports teams where we're seeing the most is football, cheerleading, and volleyball. We're also now seeing outbreaks and transmission in K through 12 classrooms, which I'll talk about just now. And then also we're still seeing outbreaks in businesses that do not enforce social distancing and they do not enforce masking. So please, anywhere that you are, please, pay attention, making sure people don't come in when they're sick. If you're sick, stay at home, and making sure you're in a place where you don't live, people you don't live with. Please mask and please social distance. And no place can be safe if you're outside your home. Or sometimes if you have somebody infected in the home, it's not safe in there either. So what our school team is finding out with our school cases is, unfortunately, as our cases, the number of cases in our community decline, and our number of cases in our schools are declining. Unfortunately, we're seeing an increase of in-classroom and transmission at the same time that the number of cases in the schools are declining. So right now, in the past 6 days, we've actually broken a record and have seen the most in-classroom transmission since we started looking at this in September. So right now there are 6 classrooms that we've documented in classroom transmission. 5 are elementary school, 1 is a middle school, and the students are in that situation are spaced 3 feet apart. Also, what we're finding that is not helping the situation is parents of infected cases are refusing to disclose the information about the other kids in the household so that they don't have to go into quarantine. But, we end up finding out who they are. I mean, the schools tell us, and when we do our investigation, so we do find out. So please just make all our lives easier, make everybody safer, and please, tell us everybody that could have come in contact with your case, even if it is somebody in your home as a child. So the good news is we're making progress on the vaccine front. So I'm going to report our vaccination data through May 3rd. So among all Erie County residents, 49% have received that first dose. So we're almost at 50%. And so that's 450,913 people have received their first dose. And among all eligible residents, 16 and up, we've vaccinated 60% with their first dose. And then those people who've received their second dose constitute 37% of our Erie County population, which is 341,865 people, and that's 45% of all eligible Erie County residents. So we're getting closer to where we want to be, but we're not there yet. So we have to be vigilant and keep on vaccinating. So if you haven't been vaccinated yet, you're on the fence, please talk to your healthcare provider. You can call us at 858-2929 to ask her any question. We're here for you with information. So this is a chart that we show every week looking at the vaccine distribution by zip code. So looking at the proportion of a population in each zip code that has received at least their first dose. So yellow corresponds to the rural area, green corresponds to the suburban area, and blue corresponds to the urban areas. So you can see that there is, still persisting a disparity, in our rural areas and many of our urban areas, and we're seeing much lower percentage of people receiving a first dose of vaccine compared to our suburban areas. And so, as the county executive mentioned earlier, we're seeing high numbers of cases in those areas where we have low vaccine penetration. So, we know what to do to protect us against disease. And one of the key elements of protection is getting vaccinated. So just want to tout our successes. So we've been doing well of increasing our numbers of 16 and 17-year-olds who have received their first dose. So as of May 3rd, 30% of 16 and 17-year-olds have received their first dose of COVID-19 vaccine. And that's up 5% from a week ago. A week ago it was only 25%. So now this week it's up to 30%. And then we are doing great getting our seniors vaccinated. So among all the Erie County residents who are over the age of 65, 77.5% have received their first dose of vaccine. And again, there's disparities there. Even though we're doing a great job with our seniors, there are areas where 100% of our seniors have been vaccinated, and there are areas where a much smaller percent have been vaccinated. So areas that have done a great job and gotten all their seniors vaccinated include West Falls, East Concord, Clarence Center, Collins Center, the Buffalo 14203 zip code, Bowmansville, and Sardinia. So we applaud you. Great job, community. Great job as seniors. And then there are zip codes where we're still struggling to get everybody vaccinated, including our seniors, who are the ones who are most vulnerable to COVID-19. And those are our rural areas and, again, urban areas. So North Collins, Buffalo 14208 zip code, Boston, sorry?
North of, did you say
I'm sorry, North Evans, couldn't read that, no glasses. North Evans, Buffalo 14208, Boston, Buffalo 14206, and Buffalo 14211. So again, if you if you live in those areas, you're 65 plus or over 65, please look for a pop-up clinic near you. Help us vaccinate you. Help us protect you so you don't have to be susceptible to COVID-19. So we have our Erie County Department of Health vaccine sites. So we have our standalone site at ECC North and South and Key Bank Center. Those were our kind of large vaccination sites, and we're kind of winding those down. So if you plan on going to one of those, please give us a call beforehand because we're changing our hours so that we have more capacity to go out in the community and meet people where they are to get vaccinated. If you want to make an appointment, you can go onto our website or call 858-2929 to make an appointment. So we are receiving a vaccine from the New York State Health Department this week. We've ordered a smaller number of doses just because the number of people that were able to get vaccinated and come to our clinics is shrinking. So we're getting a tray of Pfizer, so 1,170 doses, and 500 Johnson & Johnson doses. So people who just want to get a one and done with a safe vaccine will be able to do that. And New York State is going to distribute 7,810 vaccine doses for first doses to different venues in Erie County, like pharmacies, primary care offices, pediatric offices, colleges, and hospitals. So again, as I mentioned, we're trying really hard to get into the community to make it easy for people to make a smart choice and get vaccinated. So today we're at Pilgrim Baptist Church. So if you haven't got vaccinated yet and live near there, just come on down. We take walk-ins in every single clinic. On May 14th, we're going to be at the Community Church Jehovah. On May 18th, we're going to be at Martha Mitchell's Community Center. And then we are really trying hard to reach, again, those communities where we haven't seen great uptake. So we're going to be announcing soon new pop-up clinics in southern Erie County and in addition other places in the city. So please, pay attention. We're going to be working with your community leaders. So please listen for a vaccine clinic near you. We want to get you vaccinated. We want to get you safe. We want to get you out there. And again, you can go on our Erie County website, make an appointment, or call 858-2929, or just show up. We will vaccinate you. And as you probably heard, our county executive was made the national news this week, announcing our shot and chaser clinics, and we've actually other states have started copycatting this novel idea. So we're going to have a shot and a chaser clinic at Resurgence Brewery this Saturday, and then at the Flying Bryson Brewery on May 12th. So again, if you want to make sure that the chaser is waiting for you after the shot, you can go to our website and make an appointment, or call 858-2929, or just wander over and we will be happy to vaccinate you, and the breweries will be happy to give you a pint of beer or whatever is your pleasure with a chaser. We've also had some really fun teen vaccine events. So over the weekend, we had 3 teen vaccine clinics that were really the most fun vaccine clinics ever. And there we were able to vaccinate nearly 1,000 16 and 17-year-olds and their family members this past Saturday. So that was really a great event. They all had different prom themes and music, and it was just a lot of fun. We are going to schedule additional vaccine clinics for 16 and 17-year-olds and families. We're working with some of the schools to go in there and vaccinate their students. We're also working with our community pediatric offices and other offices that see adolescent patients. So we're able to work with them to give them vaccine, the Pfizer vaccine, so they can vaccinate their 16 and 17-year-old patients. We want to get every single person vaccinated as much as possible. And we've heard that in the next week or two, hopefully the age where people will be able to get a Pfizer's vaccine will be down to the age of 12. So hopefully we'll be able to reach even more teens. So please help us get back to normal. So Andy Slavitt, who is the White House COVID-19 advisor, has said, Everything you do is safer if you're vaccinated. Everything. So please get vaccinated, get safe, help us open up the economy, help us get schools back in where kids don't have to isolate and quarantine. Help us open up and get vaccinated. That is our ticket out of the pandemic. And then finally, I just want to give a shout out to our child care providers in our community. As you know, May 7th is Child Care Provider Appreciation Day. And we know from the very beginning of the pandemic, our child care providers have been out there taking care of our most precious resource, which is our children. So all you child care providers in Erie County, the children, thank you. The families that you serve, thank you. And on behalf of Erie County, we all thank you. So thank you very much. And with that, I am going to turn it over to our county executive to entertain some questions.
Thank you, Dr. B. Yes, thank you to all the child care providers out there. We really greatly appreciate your effort. And I do want to note before we open up the phone lines that today is Kara Kane's birthday. You may not know who she is. The members of the media know. She is the Public Information Officer for our Department of Health, and she's worked very hard behind the scenes. And the presentation you see is often the handiwork of Kara with additions from myself and Dr. B. So happy birthday to Kara King. And with that, we will open it up to questions. We will start with the Buffalo News. Sandra.
Hi, Mark. Thank you. Can you talk a little bit about the winding down of your mass vaccination clinics, or Dr. Burstein, what the new hours will be, when you're probably going to start spending less time devoting staff efforts to the mass vaccination clinics versus the pop-up clinics out in the community?
Well, we've already started to some degree. Where we reduced the number of staff that we need there because beforehand we could do 1,000 a day at some of these clinics, and we've reduced that down to less than 500. So we don't have as much staff there. We're going to be reducing times as well. So it's already started, but the goal is now to really get into neighborhoods where we see problems or we don't have the vaccination levels where we want them, to work with our partners in those neighborhoods, to get the citizens aware of it, to work with medical community in those neighborhoods so they can continue to advise their patients that the vaccination clinic will be there for them on that one day. So we are looking at moving it around. I will note the Shot and the Chaser. We actually had more people sign up for the Shot and the Chaser one at Resurgence this Saturday than we've seen in most of our first dose clinics in any day in the last couple of weeks. So we know it is at least getting more people to sign up that might not have otherwise. So we're going to be looking at these different types of ideas. I'll turn it over to Dr. Burstein to talk a little more, but the reduction has already started. We may not have shut them down. And the other thing you have to remember, Sandra, is for many of these locations, we're still going to be doing second dose clinics for a while. So it makes no sense to not have the first dose available if somebody wants to show. But we're just not seeing as much of the total in the first dose at these big sites like we did before. But that doesn't mean we might not be doing 1,000 people on a particular day at one of those sites. It just happens to be their second dose instead of their first dose.
Thanks. Well, the county executive summarized it very eloquently. So we are, and again, as we are winding down these big vaccine clinics, because right now we're targeting specific populations in specific areas and going to focusing more on certain the younger age groups too, to try to get them caught up with vaccines. So as the county executive mentioned, we still have to give a lot of second doses at these large vaccine sites. So we'll be offering first doses with all the second doses. So those schedules can't change right now because we have to stay open to give the second doses. But as we wind down and finish up the schedule for second doses, then we'll really start cutting those first dose clinics at those large sites. So it's just a matter of time, but we have to get through giving everybody their second doses because we want everybody to be fully vaccinated, especially if you just received one dose.
Mike Baggerman, WBEN.
Hi, Mark. This question is actually for Dr. Burstein, and it relates to health department guidance for wrestling, high school wrestling in Erie County. Dr. Burstein, is there any hope that you can give local schools about a season this year when it comes to wrestling specifically? And do you believe that the health department's guidance is fair, knowing that the other counties of Western New York are all allowing high school wrestling starting actually yesterday?
Well, Section 6 asked us for our guidance about what our recommendations were for about the safety of wrestling when we've had really high rates in the schools and the community. And since wrestling is a very high-risk sport, people are very close together, not really masked, and there's, even though they might wipe down everything really well that prevents skin-to-skin transmission, it doesn't prevent COVID. So our recommendation in that circumstance is that they defer the season to later on in the year. And as our numbers are decreasing, our rates are decreasing. We can't wait to get under 1,000 cases per. We can't wait to get under 100 cases per 100,000 population per over a 7-day period, because then we'll be in a lower risk transmission category, and then we will definitely reassess. However, right now we're in a very high transmission risk category. Our recommendations stand that for wrestling, we're just recommending that they postpone the season. So there is hope. Everybody gets vaccinated. We continue to social distance, keep our numbers down, continue to decrease, and our rates continue to decrease. I think we can reassess, but we have to get there first.
Thank you. Is anybody on from WBFO?
Yes, Mark. Question, there's been a lot of reporting this week that suggests that herd immunity isn't going to happen anytime soon because people just aren't getting vaccinated. From Dr. Burstein's point of view, even if you lower the age to 12 with Pfizer just getting approved for that, are we still going to be dealing with this problem for a very long time when you look at some of the second shot figures you were providing earlier in the briefing?
Before I turn over to Dr. Burstein, yes, that is a distinct, it's more than a distinct possibility. It's probably a probability at this point. We do not believe we'll meet herd immunity in Erie County, New York State, or for that matter, the rest of the country. And it's all in the hands of the public to get vaccinated. If we get vaccinated, we can reduce the further spread of this. As I said, there are people who probably died needlessly in the month of April because they didn't get vaccinated, thinking, we'll be okay. We had the most number of deaths under the age of 50 in any month, tying April of 2020. And if those individuals, I assume most of them have been vaccinated, even if they'd caught COVID, they would have had a very, very mild case if they were fully vaccinated. So the only way to reach herd immunity is for people to get vaccinated. If they refuse because they're waiting for other people to do it, so we reach herd immunity, we're never going to make it. It's one of those double-edged swords. We'll be dealing with COVID in some form or another for a while now. I don't know if, Doctor, you want to add anything else?
Yeah, it's going to be with us
Yeah.
forever. Thanks. Yes, so unfortunately, you're right. Many experts believe that we are not going to reach herd immunity in the near future, and so that means that COVID-19 will persist in our community. Albeit with more people vaccinated, hopefully there'll be lower numbers. There'll be less. That will mean less people in the hospital, less deaths. But I think it's going to be something that we have to live with for a while until we get to a place where we have enough people that are vaccinated. So that may mean that we might have to continue masking when we go to large events. We may have to take special precautions. However, we know there's an out if we can get enough people vaccinated. But until then, this is where we are.
Thank you. Andy Young, Spectrum News.
Hi, Mark. Wondering what sort of guidance or input you've had for the Erie County Fair as it makes its decision on potentially hosting the fair this year, and I know they're awaiting state guidance as well, but what is the county's role as far as the health department in helping them make that decision?
Well, we certainly will review the plan. The Fair Association would have to prepare a plan. Now that the governor has announced the New York State Fair going forward, that'll be completely under the control of New York State. And then with regards to the county fairs, we look forward to working with the Erie County Fairgrounds Association on their plan and reviewing it for the safety of those who not only are the attendees, but those who are working there. When you have the fair, if it's at full go guns, there's 100,000 people there per day. It's like a small city and in a very compressed area. So we know that is a prime super spreader event if it wasn't done properly. So we look forward to working with the fair, reviewing whatever plans they have, making recommendations, just like we're going to have to do with every single one of the food vendors. I mean, our Department of Health approves the food vendors, so we'll have to go through and ensure every food vendor is following proper protocols. They have to be spacing among the seats. We know sometimes the tables and chairs are jammed in close to each other where some of the food vendors are. They're going to have appropriate spacing. So we certainly are looking forward to working with them to try to help them open up, because I think we all want to have open fairgrounds again. This year, the Department of Health has actually approved some plans for events that have been going on at the fairgrounds. So there have been a number of events that have gone on there, especially with regards to horse shows and animal shows. So we'll be working with the fairgrounds to ensure that they can have as open and complete fair as we've had in the past. I think we're all looking forward to those days again. And I certainly just want to let the folks know associated with the fairgrounds that we're here to help, and we look forward to their plan. Channel 2, Kelly Dudzik.
Yeah, hi. We heard from a couple people who went to clinics, county-run clinics, who said they were trying to get their second dose and they were turned away because they were told it was just for people looking for first doses, and these were people who, for one reason or another, weren't able to keep their appointments wherever they got their first dose, for their second dose. So with people needing to get that second dose, are they being turned away? What's going on there? Have you heard about that happening at all?
That would not happen unless the person had not been registered. You can walk in for a first dose. You can't walk in for a second dose unless you've been pre-registered. It's possible the individual may have gotten a first dose elsewhere and then didn't get the second dose. It's also possible they tried to look them up in the system and couldn't find them. If they can't find them in the system and they're saying they're getting a second dose and there's nothing in the system that would indicate that they got a first dose, that wouldn't be possible so much with our prior registrants. It would be, I guess, possible if someone got a first dose elsewhere, like in a different state. We have said if individuals got a first dose in Florida, California, and now they're back in Buffalo, that we can give them the second dose, but we have to have that information beforehand because we may not be able to identify it on the date of. So I don't know all the circumstances associated with it. It's possible, but in all likelihood it would not have been an individual who had gotten their first dose at our clinic, and it could have been associated with someone who got a dose elsewhere, including out of state. But we are offering second doses to individuals who may have gotten their first doses elsewhere. However, we need to know about them beforehand. So they would call our 858-2929 number. They would give us their information from the other state. We'd confirm it, and then we'd set up a date for their second dose. We are not doing.
That's what it sounds like.
We're not.
That's what it sounds like. What happened? It was a Cat County issue, so it sounds like somebody just needs to call ahead.
Yeah, we do not do walk-ins for second dose at these clinics. We have them registered, so when we do a second dose clinic, we know who's coming in and at what time because they've already pre-registered. So the situation you say, if it's Cat County, then it's possible that it's someone who should have scheduled or missed their second dose scheduled for the other area, tried to get it through us, but we just don't do walk-ins in that situation. However, if they called us beforehand, we could confirm everything and then have a second dose ready for them. We have limited supply of doses at all of these clinics. We've had situations, especially in walk-ins early on, when we had a lot of walk-ins, we had to send people back to our main storage facilities to get more doses for those clinic and then drive it back out to wherever the location is. So sometimes there will be limitations, but if it's what you're saying, it was from outside the county, as I said, I could see that occurring. It's just so rare, we really haven't seen much of it. Channel 4, is anybody on from Channel 4?
Hey, it's Chris. Can you hear me?
Hi, Chris. Go ahead.
Hey, follow up on Andy's question. That was what I was going to ask, but I'll follow up by pointing this out. We had the Chautauqua County Fair earlier today canceled this year's edition of the fair, and I spoke with the fair director, and he said it was because they ran out of time. The state hasn't put the guidance out yet, and they just don't have time to get the guidance and put their plans in place. Chicago County Fair was scheduled about a month earlier than the Erie County Fair is, but do you think that these, I guess, and I understand it's a state issue, but do you recognize that these county fairs are in a tough spot waiting for this guidance? And I guess, is there anything you can say to people who are still waiting on that guidance?
Well, in this situation here, we are at the mercy of the New York State. You are correct. I know the Chautauqua County Fair is earlier. Some of the other fairs are earlier, much earlier. Erie County Fairs, of course, is later, August. It's, I think, 2 weeks before the New York State Fair. Most county fairs are held that 2-week period or before the state fair, because then you have your winners from a lot of the categories and the animal and fruits and vegetables and all kinds of other things that will then present at the state fair. So the county fairs have to finish before the state fair, usually 2 weeks before. I'm not surprised to hear about the Chautauqua County Fair. I feel sorry for the people in Chautauqua County. Hopefully we'll have enough time for the Erie County Fair to have put together a plan, presented it to us, review it, and then we can say, yes, let's go ahead under these stipulations here. And then our friends in Chautauqua County and elsewhere will be at least able to enjoy our fair, even if they won't be able to necessarily participate and present their livestock or their goods like they might at their own county fair. It is an issue, and it's kind of out of our hands because the guidance and guidelines are set by New York State. And then we are the implementers, we are the enforcers of the guidelines, but under the current rules, it is New York State that sets these levels. The counties could actually go more restrictive. And we've talked about that with regards to the plan for the football stadium in the fall. But you have to have the base. You have to have the floor that's set by New York State before you can figure out what the ceiling is. So I feel sorry for those folks who were planning on doing another fair, hopefully this year, and they're not going to be able to do it. Our goal is to work with our partners at the Erie County Fairgrounds Association and get a fair for us done this year. And if our friends from Chautauqua and other counties can enjoy our fair, we'll be all better for it. WKBW, Channel 7.
Hi, County Executive. It's Ashley Rowe here. You've been saying that the younger population has not been getting vaccinated at a quick enough pace, and we've been hearing the same thing from your partners in state government as well. I haven't really heard a solid understanding of why that is happening. What are you hearing from your experts is the reason for this, for the younger people not getting vaccinated?
Well, I'll turn it over to Dr. Burstein to answer more of that question, but congratulations, Ashley, on the great news you announced a couple days ago. Or was it yesterday?
Oh, thank you very much.
Anyway, congratulations on that. A new addition to our community. Always glad to hear about the population increasing. But I'll turn it over to Dr. B, and if you need some advice from a pediatrician, she could offer that too.
Thanks. Sorry to digress, but there's new data to show that getting a COVID vaccine will protect mom and passive transfers onto the baby, so it's very protective. And so why are the 16 and 17-year-olds not getting vaccinated as fast as our older seniors, older people in our community? Well, remember, it hasn't been that long where 16 and 17-year-olds have been eligible to get vaccinated. So they haven't had as much time. Also, 16 and 17-year-olds can only get vaccinated with the Pfizer vaccine. So they're not eligible to receive the Moderna or the Johnson & Johnson, so there are less vaccine of a supply able to access. Also, many community providers, like the pediatricians, where they would go to get their care and their other vaccines, don't currently have the Pfizer vaccine. The Pfizer vaccine, it's shipped in boxes of 1,170 doses, and the storage requirements are more extreme than the Moderna and the Johnson & Johnson. So that's why we're trying really hard to work with our community providers that see adolescents, because we're able to accept those large doses of Pfizer and then distribute smaller aliquots to the community providers who take care of these adolescents, and they can vaccinate them in their own offices. So that is one of our new strategy, is working with our community providers that see adolescents and giving them aliquots of Pfizer that they otherwise couldn't order, to help them be able to vaccinate their patients. So I feel optimistic that we will catch up. Also, we're going to be going to schools too, and where we're going to where the people are is our strategy now, is our new motto. Thanks.
Okay, we'll do the rapid fire round. Try to limit this to an hour. Is there anybody else on the phone who I didn't call on? If not, Sandra, do you have any more questions?
Yes, the Shot in the Chaser program, just wanted to get an update on it. You had mentioned that it was the first one's doing really well with appointments at Resurgence. Just wanted to see if there were, how, you could expound on that, and if there were any other restaurants or breweries that are signed up to participate down the road. Also, this might be more of a question for Dr. Burstein, but there's been complaints from the leaders of Section 6, following up on the wrestling question, about the lack of communication. They said that health department officials are refusing to meet with them, and I just wanted a response to that. Thanks.
Well, first off, the Shot in the Chaser, I know we've almost filled up a third of the spots available for Saturday, and we expect it'll get a lot busier in the end. We scheduled the second Shot in the Chaser with the first one's at Resurgence on Saturday. The next one following will be, I believe, the 12th at Flying Bison. And there's a couple others that we've already agreed to. We'll announce those when we have the dates, but there's a couple other breweries. There's also a distillery that's interested, so we've had quite a good interest in that, and we'll be announcing more on that. We did have a big meeting last week just with regards to schools and the superintendents. We actually spoke with the superintendents and had a long, important meeting last week with the superintendents. I will say this, there are a lot of organizations that want to sit down. We've had lots of organizations that want to sit down with Dr. Burstein and others, and they present us our evidence. One of the things that we go by is their high risk of transmission. And you cannot compare an area that is having a low risk of transmission with an area like ours that's a high risk of transmission. It's as simple as that. For the longest time, for a period there, we were the worst in New York State and pretty much the worst in the Northeast. And I hear from some, it's like, wow, I hear from my colleagues that are like, wow, your numbers are really bad in Erie County. And it was, yeah. You talk to organizations and groups about that, and they don't like to hear that. They don't want to hear that the numbers are bad. They just want to hear that we should do and open it up. I trust the recommendation of the Department of Health. And as you heard from Dr. Burstein today, if we can get below that 100 number, and we're not that far away from it now. We're much better and closer than we were just 2 weeks ago or a week ago. If we can get below that 100 number, we're no longer in the high risk of transmission, and therefore, I think we would be able to allow wrestling at that point. So it's in the people's hands. We keep the COVID-19 cases down, then we'll be open up more and do it in a manner that's safer to others. I'll move along. Mike Baggerman, WBEN. Any more questions, Michael?
Yep, I got one more for Dr. Burstein. This is related to schools. There's a growing concern about CDC guidance related to schools. There's multiple outlets that have reported that one of the most powerful teachers unions apparently lobbied the CDC regarding the wording of reopening guidance back in February. So I'm curious to know if you believe and are worried about this just perception that these special interest groups are influencing the guidelines that should, in theory, be based strictly on the science.
I'll turn it over to Dr. Burstein briefly, but I wouldn't think that would be an issue. From a standpoint of, I think the CDC is going to do what they think is in the best interest of the health of the community rather than than a lobbying group. I will note this, Michael. Our country has come a long way since January 20th and everything that happened before with the Trump administration and the way they were basically tying the hands of the CDC. The Trump administration did a very good job with regards to Operation Warp Speed, but they did a horrible job about responding to the pandemic throughout the whole period. And I know the CDC and the FDA is in a much better position now than it ever was effective January 20th at noon.
Hey, Mike. I know that there are a lot of special interest groups out there that are lobbying for their own interests nationally, at the national level, and also at the local level. However, as the county executive said, CDC is using evidence-based guidelines. They don't cower to those special interest groups, especially right now in this administration. I used to work in the Division of Adolescent and School Health at CDC. I know the people that write those guidelines. They wouldn't cower under that type of pressure. Those are good guidelines. The state writes guidelines, and what we do in Erie County is the state writes the guidelines for school. They set school policy. The school's role is to interpret that New York State policy and implement it, and the Erie County Health Department's role is to conduct the case investigation and isolation and quarantine. So we all have our own roles, and I think from the public health standpoint, we are standing hard. We are not going to be influenced by anybody's special interests, both here in Erie County, nor at the state level, and nor at CDC.
The Dean of the news media, Michael Desmond, any more questions?
Yeah, you've talked a lot during all of this about trying to get the vaccinations and the treatment and so forth to kind of match the demographics of Erie County. Now that we're getting down into 16 and 17-year-olds where the demographics are very different from the community at large, are you seeing differences in the 1,000 people who came in last Saturday to be vaccinated?
I'll turn it over to Dr. Burstein for that. I really can't answer it.
Well, Mike, that's it's really tough because first of all, there are only 30% of our 16 and 17-year-olds have been vaccinated. So that number of people who've been vaccinated is very, very small, and I think it would be kind of difficult to draw conclusions. I think just based on the population of what we did this past Saturday, there are more adolescents that live in the suburbs compared to the city. So our suburban sites had a little bit higher numbers of 16 and 17-year-olds compared to the city. However, we want to reach out to everybody, and I think we have to get some more numbers of 16 and 17-year-olds vaccinated before we can say anything firm about the demographics of that vaccinated age group. And I just also want to say, if people have questions about the vaccine, if they're on the fence, talk to their healthcare provider. I know these are really new vaccines, and I know people have a lot of questions, and that is fair. Just please, or call us at 858-2929. Help us answer your questions and allay your concerns. And I know there's a lot of information out there and questions out there, and it can be very confusing. But please go to a credible source like your healthcare provider, or call us at the health department at 858-2929, so we can help you walk through that confusion and help you make a smart choice. Thanks.
Andy Young, Spectrum News. Any more questions, Andy?
Yeah, as the state continues to ease restrictions, and we're going to see a big jump in those, I think, in the month of May here.
Yes.
Have there been any more discussions at all with the state about your plan for vaccinations at Highmark Stadium and KeyBank Center in the fall?
We've had some discussions. I think it's evident that the governor says he wants to have as large a crowd there as possible, and he said the best way to do that is vaccinating. It's still some time, and there's a lot of things that have to go into setting up for the fall. Let's just say there have been discussions, and I'm hopeful that in the end we will have a full house at the football stadium this fall, as well as for Sabres games in the fall as well. And it would be nice. It would have been nice to have a full house there yesterday for the Sabres games. Watch Michael Hauser, who's bounced around the minor leagues forever, get his first win in his first game as a NHL goalie. That would have been awesome to have 19,000 there. Congratulates him and the team for the nice victory. But there'll be continued discussions as we go forth. It's still pretty early, and one of the reasons why we brought it up early in April was so that we could have these discussions through May, June, and July and have it all set in place before the first preseason game in August. Kelly, Channel 2.
As Pfizer's approved for 12 to 15-year-olds, how does your strategy to reach that age group change? How do you adapt what you're doing now to reach that young?
I don't think it changes a whole lot from what we're doing with the 16 to 17-year-olds, because they still need to have the approval of the parents to do the 16 and 17-year-olds. We will continue to work with the pediatricians. I think that is where we're going with a lot of our doses moving forward, is to work with the pediatricians. to vaccinate these younger age groups. As Dr. Burstein noted, there is an issue, though, because of the difficulties with storage of the Pfizer, how many it comes in a tray. It's not like you can just ship 10 doses to a pediatrician. It also requires the coldest storage of any of the drugs, and we have the ability to store it here. So Dr. Burstein has already began having multiple conversations with pediatric groups and pediatricians about how we could get them the doses as they need on a smaller basis so that they could vaccinate their patients who just happen to be in the younger category. But the conversations are already had. It'll be the same discussions and conversations we're having. And it's also through the schools. We've already begun having discussions about doing direct vaccination of 16 and 17-year-olds in high schools. And if by chance they allowed 12 to 15-year-olds as well, then we're going to try to expand those by working with the schools to do the 12 to 15, not just the 16 and 17-year-olds in the schools, so they can get it done in a setting that they trust, having the parents' approval beforehand. Chris, any more questions, Channel 4?
Yeah, I know you said no a couple weeks ago, but I suspect you're going to keep getting this question until the answer is yes. Have you seen the Bills Stadium study yet?
As I say in any other situation, we never discuss the ongoing status of negotiations other than to say that there are negotiations. And I've had conversations with the Buffalo Bills, and I've had conversations with New York State. In fact, we have a meeting tomorrow, but it is not associated with any new stadium or renovation. It's just our usual meeting that we have annually to go through things that we're doing, like what toilets are we fixing and things like that at the stadium. Not the most exciting stuff, but I'll just leave it that the Bills and the state and the county are moving forward with the process. We are not anywhere near where we're going to come together and announce it. But I think it's fair to say that everyone understands that the lease expires in 2023, and as a result, we need to get off our high horses and get those discussions going, and some of the discussions have happened already, but it's going to be some time before I come forth with others to announce whatever it is that we have in front of us. And
do you suspect they might present you with that study tomorrow?
I will not go into anything, Chris, with regards to the substance of the conversations, other than to say we have a very good relationship with the Buffalo Bills and a good relationship with New York State, and this is going to be a long process. Final question to Ashley Rowe. Ashley.
I'm all set. Thanks, Mark.
You're all set? Okay, thank you. One final thing before we go, I want to give some words also of encouragement to Ted Shred of Shred and Reagan from 103.3. I know he was quite ill. We were actually texting, and it sounds like he is out of the hospital. That's a good thing. I do know others in our community that are considered community leaders, members of the media, who it's heard that they've suffered COVID. You shouldn't be ashamed about it. If you had it and you can be a benefit to our community to tell people to get vaccinated because COVID is very sick, please do what Ted did. He relayed his story, and it got a lot of people thinking, wow, he's not that old guy. He was very sick. I'm glad he's on the road to recovery. But if it could happen to him, it could happen to a lot of other people. So if there's members of the media, sports athletes, others out there who've been sick, we certainly appreciate your stories because it helps us to let the public know about the seriousness of COVID-19 and why it's so important to get fully vaccinated. So Ted, glad to know that you're on the road to recovery. Get your strength back, and I'll be looking forward to getting back on the radio with you and Tom Reagan soon enough. So with that, to everyone else, get vaccinated. It's our best way to get back to normal. We are doing better. Our numbers are going down. And if we continue to vaccinate more people and make certain that we're doing the right thing to protect ourselves, we'll be back to normal a lot sooner than other parts of the country. And we are doing better than other parts of the country now on vaccinations, but we were doing really bad with regards to cases. I'm glad to see the case numbers go down. So to all, be safe and well, and take care.